Disability categories. I'm Dr. Lisa Silmser. In the United States, the Individuals with Disabilities Education Act, or IDEA, requires public schools to provide special education and related services to eligible students, but not every child who struggles in school qualifies. To get special education services, a child's school performance must be adversely affected by a disability in one of the 13 categories. It's also important to note that because education is a function of state governments, qualifications for educational disabilities may be different from state to state. Also, it's important to note that when talking about students with disabilities, it's important to use person-first language rather than saying autistic boy. It's better to say he's a boy with autism. The disability is one part of a person, not the whole person, and using person-first language helps us to put the person first. Another thing that makes it a bit confusing is that we need to be aware that there are differences between diagnoses by medical professionals and educational labels determined by teams of educators. Both can be called disabilities, but services can be very different. This presentation focuses on educational labels defined by IDEA. Section 300.8 explains what is meant by the phrase child with a disability within the IDEA regulations. Child with a disability means a child evaluated in accordance with the regulations as having an intellectual disability, a hearing impairment, including deafness, a speech or language impairment, a visual impairment, including blindness, a severe emotional disturbance, referred to in this part as emotional disturbance, an orthopedic impairment, autism, traumatic brain injury, and other health impairment, a specific learning disability, deaf-blindness, or multiple disabilities, and who, by reason thereof, needs special education and related services. Currently, 14% of children are identified as having a disability. Going in alphabetical order, we'll start with autism. Not the official definition, but one that many teachers have adopted, goes with the letters in the word autism. Always unique, totally interesting, sometimes mysterious. Autism is a developmental disability that significantly affects verbal and nonverbal communication and social interaction. It's generally evident before age 3, and that it adversely affects a child's educational performance. Other characteristics often associated with autism are engagement in repetitive activities in stereotyped movements, resistance to environmental change or changes in daily routine, and unusual responses to sensory experiences. It's important to note that some states identify autism as the broader term autism spectrum disorder, or ASD, which suggests that there's a wide range of challenges that are characteristic of this disability. I'm glad we started with this category because it's often said that if you know one child with autism, you know one child with autism. There really doesn't seem to be a textbook case, as children with disabilities all have their own unique characteristics. 1.4% of students in U.S. schools are identified as having autism. But remember, their disability is not the only thing to know about them. Deaf-blindness means the presence of both hearing and visual impairments, the combination of which causes such severe communication and other developmental and educational needs that they cannot be accommodated in special education programs solely for children with deafness or children with blindness. Less than 0.1% of students in the U.S. fit into this category. Deafness means a hearing impairment that is so severe that the child is impaired in processing linguistic information through hearing, with or without amplification, and that it adversely affects a child's educational performance. Children with developmental delays are between the ages of 3 and 9 and show significant delays in the areas of physical development, cognitive development, communication development, social or emotional development, or adaptive development, and because of that, need special education and related services to progress. Of U.S. students, 0.9% of them are identified as having developmental delays that warrant special education services. 0.7% of all U.S. students have been identified as having an emotional disturbance. This is a condition exhibiting one or more of the following characteristics over a long period of time and to a marked degree that adversely affects a child's educational performance. An inability to learn that cannot be explained by intellectual, sensory, or health factors, an inability to build or maintain satisfactory interpersonal relationships with peers and teachers, inappropriate types of behavior or feelings under normal circumstances, a general pervasive mood of unhappiness or depression, a tendency to develop physical symptoms or fears associated with personal or school problems. Emotional disturbance includes schizophrenia, and the term does not apply to children who are socially maladjusted unless it's determined that they have an emotional disturbance under paragraph C4I of this section. Emotional disturbance in some U.S. states is connected to behavior disorders, like in Minnesota, where we have a label called EBD, or emotional behavioral disorder. Hearing impairments means an impairment in hearing, obviously, whether permanent or fluctuating, that adversely affects a child's educational performance, but that is not included under the definition of deafness in this section. The National Center for Educational Statistics says that 0.1% of students in the U.S. have a hearing impairment. Intellectual disability means significantly sub-average general intellectual functioning, existing concurrently with deficits in adaptive behavior and manifested during the developmental period, that adversely affects a child's educational performance. The term intellectual disability was formerly termed mental retardation. It's important to be aware that the term regarding disabilities have changed over time. Being aware of better ways to talk about disabilities is important for teachers, as they are often role models for others and should strive to be the most respectful with their words. 0.9% of school-age children are identified as having an intellectual disability. Multiple disabilities means concomitant impairments such as intellectual disability with blindness or intellectual disability with orthopedic impairment, the combination of which causes such severe educational needs that they cannot be accommodated in special education programs solely for one of the impairments. However, multiple disabilities does not include deaf-blindness, as this has its own category. 0.3% of the school population qualifies as having multiple disabilities. Orthopedic impairments means a severe orthopedic impairment that adversely affects a child's educational performance. The term includes impairments caused by a congenital anomaly and impairments caused by disease and impairments from other causes. Roughly 0.1% of children have an orthopedic impairment. There are challenges that children face that impact their ability to perform that don't really fit into other categories. OHI, or other health impairments, is a category that includes many things. Other health impairments means having limited strength, vitality, or alertness, including a heightened alertness to environmental stimuli that results in limited alertness with respect to the educational environment. That is due to chronic or acute health problems such as asthma, attention deficit disorder, or attention deficit hyperactivity disorder, diabetes, epilepsy, a heart condition, hemophilia, lead poisoning, leukemia, nephritis, rheumatic fever, sickle cell anemia, and Tourette's syndrome, and adversely affects a child's educational performance. 2% of all students meet the criteria for OHI, and it is the third highest category of the federal disabilities. SLD is the most common disability category, with 4.6% of all children meeting these criteria. Specific learning disability means a disorder in one or more of the basic psychological processes involved in understanding or in using language, spoken or written, that may manifest itself in the imperfect ability to listen, think, speak, read, write, spell, or to do mathematical calculations, including conditions such as perceptual disabilities, brain injury, minimal brain dysfunction, dyslexia, and developmental aphasia. SLD is an exclusionary disability, which means that other areas must be excluded before a child is identified as having a learning disability. Disorders not included? Specific learning disability does not include learning problems that are primarily the result of visual, hearing, or motor disabilities, of intellectual disability, of emotional disturbance, or of environmental, cultural, or economic disadvantage. The second most common disability, 2.7% of school children, have speech or language impairments. Speech or language impairments means a communication disorder, such as stuttering, impaired articulation, a language impairment, or a voice impairment that adversely affects a child's educational performance. TBI, or traumatic brain injury, means an acquired injury to the brain caused by an external physical force, resulting in total or partial functional disability or psychosocial impairment, or both, that adversely affects a child's educational performance. Traumatic brain injury applies to open or closed head injuries, resulting in impairments in one or more areas, such as cognition, language, memory, attention, reasoning, abstract thinking, judgment, problem solving, sensory, perceptual, and motor abilities, psychosocial behavior, physical functions, information processing, and speech. Traumatic brain injury does not apply to brain injuries that are congenital or degenerative or to brain injuries induced by birth trauma. 0.1% of school-age children are identified with a TBI disability. Lastly, visual impairment includes blindness, which means an impairment in vision that, even with correction, adversely affects a child's educational performance. The term includes partial sight and blindness. There are 0.1% of children who have visual impairment. The education of children with disabilities is a worldwide issue. Although IDEA is a law in the United States, the United Nations also has guidelines specific to the treatment and rights of people with disabilities. The Convention on the Rights of People with Disabilities includes agreements about the education of children with disabilities. Culture, socioeconomic development, and religious beliefs impact the treatment of these children. However, efforts continue to move forward as more countries are determined to serve the educational needs of all of their citizens. Importantly, what does the Bible tell us about how God views people with disabilities? Interestingly, he didn't seem to think of disabilities as a reason to let people take a lesser part in history. The Bible is full of stories about people whose disabilities were not a barrier to them playing a vital part in the history of God's people. Based on the descriptions in the Bible, Moses either had a speech impairment or was deeply impacted by anxiety. Elijah suffered from depression, and Jonathan had a traumatic brain injury. There were many people with emotional disturbances, orthopedic impairments, and blindness. The Bible says that each of us was created in God's image and that He loves us, flaws and all. Best of all, the Bible tells us that through Him, all things are possible. As believers, we need to function in the same way, loving all people and seeing possibilities, even when there are disabilities.